Today we are talking to Dr. Anish Shah from Siyan Clinical. How are you doing today?
I'm doing well, Ro.
We had a couple of questions for you. My first question is, what is Project Hope and who runs it?
Ro, as you know, that there is a huge opioid epidemic in our country. We have about 130 people dying every day in America from opiate addiction. The problem is even more serious in Northern California. If you look at Sonoma County, we have a citizen who dies every 8th day. In Mendocino County, we have 2 deaths every month. And in Lake County is actually number 5 in entire USA for opiate-related deaths. So with the problem that we have right now, we have been funded by SAMHSA to run an opiate dependence program here in Santa Rosa. And Project Hope is an outpatient program in Santa Rosa to help people suffering from opiate addiction. It is run by a group of experienced professionals that I lead, and they are the most dedicated group of clinicians that I have ever worked in this field. In our team, we have a psychiatrist, psychotherapist, nurse practitioners, and case managers. And in Project Hope, we see each patient as a unique individual with a unique set of clinical problems, and we have individualized treatment plans, which are an extremely important part in success of patients combating addiction.
And what does MAT stand for, and how does that work?
Well, we are not short of acronyms in medicine, that's for sure. So MAT stands for Medication-Assisted Treatment. Essentially what MAT means is that we have several treatment modalities for treating patients with opiate addiction. The primary treatment modalities is pharmaceutical treatment or pharmacological treatment, which involves advanced medicine to help ease the craving for patients suffering for opiate addiction and also managing their withdrawal. But, in fact, the medication is just one piece of the whole treatment picture here. We also utilize various forms of psychotherapy, which involve individual and group therapy, case management services, and then in our toolkit now we have a latest technological innovations such as online cognitive behavioral therapy, which is also an FDA cleared treatment for people with opiate dependence, which kind of works like a supplemental to the other counseling sessions that the patient receive. It's like a therapist that they have at their home. Basically, the online cognitive behavioral therapy is when the patients use treatment modalities using their phone or desktop.
Again, we're talking to Dr. Anish Shah from the Siyan Clinical. And my next question here, what are the major reasons that people become addicted?
That is one question that obsesses all of us, and that indeed is an important question. We do more now than we used to know, and I am happy to address that. So if you look at it, opiate triggers the release of endorphin in your brain. That's like a feel-good neurotransmitter. And an endorphin alters your perception of pain and boosts the feeling of pleasure, and that in turn creates a temporary yet very powerful sense of well-being. When an opiate dose wears off, you may find yourself wanting these feelings to come back as soon as possible, and this is the first milestone on the path toward opiate addiction. And generally what we know as those factors that increases one's chance for addictions are if you are taking opiates longer than originally intended or prescribed by your provider, life factors such as poverty, unemployment, family history of substance abuse, personal factors such as common mental health disorders, habitual smoking, history of severe depression and anxiety, and prior history of drug and alcohol use which makes you more vulnerable towards opiate addiction. And the one interesting fact is women have actually a unique set of risk factors that makes them more vulnerable to developing opiate addiction. For example, women are more likely to have chronic pain and report it to physician. They're more likely to be prescribed opiate medication, and they're also more likely to be prescribed higher dose for longer period of time. And that is one of the reasons why women are more vulnerable to opiate addiction.
That's interesting. What are the steps to receiving help through Project Hope?
Well, the first thing I would like to tell all listeners that opiate addiction is not a failure of willpower or giving up. It's not a moral failure. Addiction is a treatable, chronic medical disease that involves complex interaction of brain circuits, genetics, and one's environment, and also individuals' life experiences. People with addiction use substances or engages into a behavior that continue to harm themselves and their behavior, and the family actually. And then we are here to help. A patient or a family member can get information about how to receive help by calling us at Project Hope on 707-206-7268 and extension 16. And then you can also send a referral to your physician by faxing us on 707-206-7254. You can find more information about our program through hopemet.org, which is hopemet.org, which is our website. You can also submit information about your problem and have one of our staff call you back through our website. So there are various ways which you can reach us out and seek help.
And I know probably different patients have different schedules here, but how long does it take to see an improvement in a person's addiction?
Well, I wish I could give you a time frame for treatment because, essentially every patient, every individual with addiction is different. Some patients need shorter treatment periods to get better. Some patients may need longer. One thing to keep in mind is addiction is a chronic, relapsing illnesses, and it is sort of a, and it's also not uncommon that some patients may need treatment for life.
What are the different treatment modalities available for opiate dependence?
Well, I'm glad you asked that because we have lots of treatment options than people realize. I would start with medication treatment, and the main treatments involve using naltrexone, Vivitrol, buprenorphine, long-acting buprenorphine injections such as Sublocade. We also have medication that can help with withdrawal symptoms of opiate addiction. So those are the primarily medication treatments available. The other thing is individual psychotherapy, group therapy, and also the online cognitive behavioral therapy, which is an sort of an adjunct treatment to the conventional treatment modalities, which is available in our toolkit right now. Essentially, that is a treatment in which someone can use their phone or a desktop to receive psychotherapy at their home in their own environment when the therapist is not available to them.
And how does that medication work for opiate dependence treatment?
Well, that's a good question, and I want to clear that medications are a very important solution in treatment of opiate dependence. Medications help with withdrawal symptoms. They also help with craving of opiates, and most importantly, medication prevents opiate overdose death. So, for example, the medications such as Roboxin, Clonidine, Trazodone, Lofexidine help with opiate withdrawal symptoms. Medications such as naltrexone, Vivitrol injections, long-acting buprenorphine injections such as Sublocade or buprenorphine or Suboxone helps with opiate cravings. And there are also medications such as naloxone that helps with reversing an opiate overdose-related potential death in respiratory depression.
And what is the impact of opiate dependence to patients, family, and even to society?
Rose, it's a good question, and we have and I want to emphasize this: opiate addiction affects our society in many ways. Obviously, dependence causes the anxiety, not only to the patients but also everyone around them. When your loved one is addicted, it kind of impacts the whole family. We know that there are higher incidents of divorce, unemployment, and social isolation with families with patients who have been addicted with opiates. Opiate dependence also has a very high healthcare cost. And most importantly, they're losing lives. We are losing lives daily from opiate addiction.
And we are talking to Dr. Anish Shah, and I've got a couple more questions, and I'll let you go. What are some of the comorbid psychiatric disorders that we see with opiate dependence?
I think what we see in our clinical practice, comorbid major depression, generalized anxiety disorder, post-traumatic stress disorder, bipolar disorder. These are some of the very common comorbid disorders that we see in patients with opiate addiction. And I want to once again emphasize that treatment of these psychiatric disorders are equally important in achieving successes in patients with opiate addiction.
And what are different types of psychotherapy that may help patients with opiate dependence?
Well, there are a few approaches to take, and I want to emphasize that individual treatment plan will be different for everyone, and one form of psychotherapy works for someone, the other form of psychotherapy works for other one. What we have right now is motivation interviewing techniques, trauma-focused therapy, cognitive behavioral therapy, peer support group, and like I explained before, innovative adjuncting treatments such as online cognitive behavioral therapy.
Well, before I let you go here, again, can you share that number with us?
The number to call us is 707-206-7268, extension 16.
All right, Dr. Anish Shah, thank you so much for taking time out to talk to us today.
Thank you, Rob, for your time, too.